Welcome to the Dental Anatomy lecture series. In this video, we will be discussing about the morphology of permanent maxillary central incisor. Permanent maxillary central incisors are a part of anterior teeth in the maxillary arch. These teeth are important for the aesthetics and speech and also for incising food. Now, let us delve into the developmental timeline of the maxillary central incisor. So, permanent maxillary central incisors show the first evidence of the calcification. They show the first evidence of the calcification at around 3 to 4 months after birth. And enamel formation is completed by around 4 to 5 years. By 4 to 5 years, enamel formation is completed. And the teeth is getting erupted into the oral cavity by 7 to 8 years. And root formation is completed at 10 years. That is approximately 2 to 3 years after the teeth erupts into the oral cavity, root formation is completed. So this is about the developmental timeline of the permanent maxillary central incisor. Next, let us look at the measurements of the maxillary central incisor. Cervico-incisal length of the crown is 10.5 mm and the length of the root is 13 mm. And the mesial and the distal diameter of the crown is 8.5 mm and at the cervix it is 7 mm. Labio-lingual diameter of the crown is 7 mm and at the cervix it is 6 mm. And on the mesial side, this is the mesial side of the tooth and this is the distal side of the tooth. So on the mesial side, curvature line is measuring 3.5 mm. Curvature line is measuring 3.5 mm. On the distal side, the measurement is 2.5 mm. There are 5 aspects of the permanent maxillary central incisor. This is the labial aspect, this is the lingual aspect, and this is the mesial aspect, this is the distal aspect, and this is the incisal aspect. Let us begin our discussion with the labial aspect of the maxillary central incisor tooth. So this is the image of the right permanent maxillary incisor and this is the mesial side of the tooth and this is the distal side of the tooth. So how did I tell that this is the mesial side and this is the distal side? By looking at the incisal angles. This is the mesio-incisal angle and this is the disto-incisal angle of the permanent maxillary central incisor. So mesio-incisal angle is always sharp in the maxillary central incisors and the disto-incisal angle is rounded. So by looking at these line angles, I have differentiated it which side of the tooth is mesial and which side of the tooth is distal. When you visualize the permanent maxillary central incisor from the labial aspect, you can appreciate 4 outlines. This is the mesial outline, this is the distal outline, this is the cervical outline, and this is the incisal outline. When you look at the mesial outline of the crown, it is slightly convex. Slightly convex. But when you look at the distal outline of the crown, it is more convex when compared to that of the mesial side. This is another differentiating feature between the mesial and the distal side of the crown. And next, when you look at the cervical outline, it is pointing towards the root. And when you look at the incisal outline, it is pretty much straight. And you can also see the root from the labial side. And this root from the labial side is appearing like a cone. And it is also having a blunt apex. And towards the mesio-incisal angle, there is a crest of curvature. So crest of curvature, which is also representing the contact point. So this contact point seems like it is approaching the mesio-incisal line angle. Contact point is a place where this maxillary central incisor is contacting with the adjacent tooth. So this is the right permanent maxillary central incisor and this is the left permanent maxillary central incisor. These two teeth contact on the mesial side at this contact point. On the distal side, the contact point is slightly higher when compared to that on the mesial side. So on the distal side, contact point is slightly higher and it is towards the cervical line when compared to that on the mesial side. So the contact point on the distal side is contacting the mesial aspect of the lateral incisor. Next, let us look into the lingual aspect of the permanent maxillary central incisor. So from the lingual aspect, when the crown is visualized, there are some convexities and concavities on the crown. So convexity is seen just beneath the cervical line. This convexity is known as cingulum. Just beneath the cingulum, you see the concavity. So this concavity is known as lingual fossa. Surrounding the lingual fossa, you see marginal ridges. These are the marginal ridges. This is the distal side of the tooth and this is the mesial side of the tooth. So this marginal ridge is known as mesial marginal ridge and this marginal ridge is known as distal marginal ridge. And incisal ridge is slightly elevated and it is merging with the distal and also the mesial marginal ridges. When you look at the crown and the root on the lingual aspect, they are tapering from the labial aspect. Take the cross section of the root at the cervix. You can see it is in the triangular shape. This is the labial side and this is the lingual side. So on the lingual side, the crown and the root are tapering. So when the crown and the root both are tapering towards the lingual side and hence in the cross section it is giving a triangular shape. This is the labial side and this is the lingual side. And labial side is appearing broader when compared to that of the lingual side because of the tapering of the crown and the root towards the. When you look the maxillary central incisor from its mesial aspect, you can see the crown of the central incisor is in the triangular shape or it is in the wedge shape. The base of the triangle is towards the cervix and the apex of the triangle is towards the incisal ridge. This is the incisal ridge. Apex of the triangle is towards the incisal ridge. This is the labial side of the teeth and this is the lingual side of the teeth. Now, how did I tell that this is the labial side and this is the lingual side? By looking at the convexities and concavities. So from the mesial aspect, you see convexities on this side. This convexity is representing the cingulum. Cingulum is found on the lingual aspect. Hence, it becomes the lingual side of the tooth. So below the cingulum, you will find the concavity, which is known as lingual fossa. So from the mesial aspect, when you look at the lingual outline of the crown, you will find the cingulum, lingual fossa, and the incisal ridge is slightly elevated here. This is the incisal ridge. When you look at the labial outline, it is slightly convex and it is smooth. And from the mesial aspect, as we have already mentioned that the crown of the tooth is in the triangular shape. When you draw a line from the center of the root and the center of the crown, this line is bisecting the apex of the triangle. So this is the apex of the tooth. The line which is drawn from the center of the root and the crown is bisecting this apex. So this states that incisal ridge is in line with the center of the root. So when you look at the greatest portion of the labiolingual diameter, so this is the crest of the curvature on the lingual side and on the labial side. So just coronal, this is the cervical line, just coronal to the cervical line, you will see the crest of the curvature, which is representing the greatest labiolingual diameter. And the diameter at this portion is 7 mm. And the root on this side is again cone shape and it is having blunt apex. Next, let us discuss about the distal aspect of the permanent maxillary central incisor. So there is a little difference between the mesial and the distal aspects in regards to the cervical line. Cervical line on the mesial side is showing more curvature when compared to that on the distal side. So on the distal side, the cervical line is 2.5 mm and on the mesial side, it is 3.5 mm. So from the distal side, the crown, especially at the incisal third, is appearing thick. Why is it appearing thick? This is because of the slope of the labial surface towards the distolingual side. Because of the slope of this labial surface towards the distolingual side, the incisal third from the distal side appear to be thicker. So when you look at the permanent maxillary central incisor from the incisal aspect, the labial side of the crown is appearing broader than that of the lingual side. This is the labial side and this is the lingual side. So labial side is appearing broader here when compared to that of the lingual side because of the tapering. So both the crown and the root are tapering towards the lingual side. That is the reason why when you look the teeth from the incisal aspect, you see the labial side is much broader when compared to that of the lingual side. And here incisal ridges are clearly appreciated. Mesio-incisal angle and the disto-incisal angle are also clearly appreciated. And cingulum is located at the cervical line. And when you draw a line from the mesio-incisal angle towards the cingulum and the disto-incisal angle towards the cingulum, the distance from the cingulum to the disto-incisal angle is longer. By this, we have completed our lecture on the morphology of permanent maxillary central incisor. If you want to have an overview of the same topic, you can visit the link below in the description where there is a PDF available on the gist of the permanent maxillary central incisor morphology. If you found this video helpful, hit the bell icon below and subscribe to my channel, and stay tuned to Tooth Fairy Tales for more dental videos.